Do you know what to do if someone collapses in front of you? Unfortunately, the answer is no for many of us. It's crucial to know CPR, or cardiopulmonary resuscitation, a life-saving technique that can make the difference between life and death. Picture this: someone suddenly collapses, unconscious, their heart not beating properly. In such a scenario, knowing how to administer CPR can literally save a life. Let's dive into the steps of performing CPR. It's simpler than you might think. The first and foremost thing you need to do is call for help. Dial your local emergency number without delay. In many places this is 999, but it varies by location, so make sure you know your local emergency line. Swift action is crucial in emergency situations as every second counts. Your call sets into motion a chain of life-saving events, ensuring that professional medical help is on its way. While help is on the way, it's time to step in and do your part. Before you start CPR, you need to check if the person is responsive and if they are breathing. To gauge responsiveness, gently tap the person's shoulder and ask loudly, "Are you okay?" If there's no response, it's clear the person is unconscious. Next, we need to check for signs of breathing. This is a three-step process. First, look for chest movements. Is the chest rising and falling? If not, it's a cause for concern. Second, bring your ear close to the person's mouth and listen carefully. Can you hear any breath sounds? Remember, occasional gasps do not count as normal breathing. Lastly, feel for the person's breath on your cheek. If you can't sense any air being expelled, it's likely the person is not breathing. The importance of these checks cannot be overstated. They help determine the urgency and type of help needed. If the person is unresponsive and not breathing, it's time to start CPR. The primary component of CPR is the chest compression. It's the lifeline that could save someone experiencing cardiac arrest. Now let's delve into how to perform chest compressions. Firstly, the position of your hands is crucial. Place the heel of one hand in the center of the person's chest. Nestle the other hand on top of the first, interlocking your fingers. Keep your elbows straight and shoulders aligned directly over your hands. Now, onto the compressions themselves. You're aiming to compress the chest by about 2 inches or 5 centimeters. It's essential to push hard and push fast. The recommended rate is at least 100 to 120 compressions per minute. You can think of it as the beat of a fast-paced song, but it's not just about the compressions. It's equally important to allow the chest to recoil or rise fully between compressions. This allows the heart to refill with blood. If the chest doesn't fully rise, the next compression won't be as effective. Remember, chest compressions can be tiring. If you're feeling fatigued, ask someone else to take over if it's possible. It's vital to maintain the quality and speed of the compressions. Lastly, bear in mind that these compressions aren't performed in isolation. They're part of a cycle. After you've given 30 compressions, it's time for the next step in the CPR process: rescue breaths. The rhythm of life-saving continues. Rescue breaths are crucial in CPR to get oxygen into the person's lungs. To start, you'll need to open the airway. Tilt the person's head back slightly and lift the chin. This clears the passage, enabling the air to reach the lungs. Now let's talk about giving the rescue breaths. Pinch the person's nose closed. Take a normal breath, place your mouth over theirs, and blow until you see the chest rise. Watching the chest rise is essential. It's a clear indication that the air is reaching the lungs. But what if the chest doesn't rise? You might need to adjust your position, or the head tilt and chin lift. Make sure the airway is open and try again. It's important to maintain a rhythm in CPR. After every 30 chest compressions, give 2 rescue breaths. This alternation between compressions and breaths is key to effective CPR. Remember, the cycle is 30 compressions followed by 2 rescue breaths. So, to recap, CPR can be a lifesaver when someone collapses and isn't breathing. Remember the sequence. First, call for help. Next, check for responsiveness in breathing. If the person is unresponsive or not breathing, start with chest compressions. These help keep blood flowing. After every 30 compressions, give 2 rescue breaths to supply oxygen. These steps are critical in sustaining life until professional help arrives. Learning CPR could mean the difference between life and death for someone, so take the time to learn it and you could be a lifesaver.